Welcome to CUNY TV presents COVID-19 Crisis in Motion, a virtual town hall meeting. I'm Mike Gilliam. We are in the crosshairs of the coronavirus, and it's bearing down hard on all of us. The death toll continues to climb each and every day, and our lives, well, they've been turned completely upside down. There's stress just about everywhere you look. The hospitals are overwhelmed. CUNY and other schools are closed. Jobs have been lost. And there's really no word on when or if things will actually return to normal. Let's start our conversation with CUNY's leading expert on the spread of the coronavirus and a member of the CUNY Coronavirus Task Force, Dr. Bruce Y. Lee. Welcome, Bruce.
Thanks for having me, Mike.
You're an expert on the modeling. They're predicting mass deaths, hundreds of thousands. Do you agree?
Well, if you look at the numbers, this new coronavirus is deadlier than the deadliest flu season. So the flu virus in the worst year is about 0.1% in terms of mortality. And so far, all the numbers are much higher than that in terms of the mortality associated with this SARS coronavirus 2. So if you do the math, it's not surprising that we are going to have a number of deaths, potentially the order of magnitude that you mentioned. It's hard to say the exact number, but we know there's going to be a significant number of deaths.
We keep hearing about underreporting of cases around the world and also here, and also a lack of testing. Could these numbers actually be much larger than what we're talking about?
Yeah, that's a challenge. So number one, we don't know the actual number of cases, especially in the United States, since there hasn't been widespread broad testing. Most of the testing has been passive surveillance. And when I say passive surveillance, I mean that you wait until people show up to the emergency room or the doctor's office, and then they get tested because they already have symptoms. But that doesn't count the whole lot of people who may not show up to healthcare and may not get tested. So it's not active surveillance. And on top of that, you have people, potentially close to 20% of people who may be asymptomatic throughout their entire infection, but still be carrying the virus and spreading the virus. So without more widespread testing, we can't know those numbers.
The Graduate School of Public Health just did its third survey of New Yorkers, trying to figure out exactly where they are on all of this. What did you find?
Yeah, so not surprisingly, there is a fairly substantial percentage of folks who are experiencing stress 3 to 4 days a week. They're not feeling optimistic and experiencing stress from all the news, all the social distancing, and all the changes, et cetera. So one of the big concerns, of course, is from the virus itself, and also the measures that have to be implemented. This can be very taxing on mental health. So we have to keep in mind that other health issues don't go away when we're tackling the coronavirus. That we have to be mindful of how people are feeling, because we do know that mental health issues are a problem even when you don't have a pandemic like this. You add the additional stressor of a pandemic, and it can push people over the edge. So we have to be very careful about that.
We're going to touch on some of that in just a bit. But first, I want to bring in a member of our CUNY family. Scarlet Velour works for CUNY TV as a video engineer. He's recovering from the coronavirus, and we want to talk to him a little bit about his ordeal. Scarlet, you with me there?
Hi, Mike. Thanks for having me.
Let me talk about your situation. You had the virus. What was the worst part of your ordeal?
I think the worst part of my virus was just the sense of trying to get the testing and not being able to get the testing anywhere. After that was just some of the symptoms were really bad, like body aches. The pain in my body was just like amazingly bad. I also had some of the symptoms. I didn't have much fever, but some of the symptoms were really bad on me.
When you think back on it, do you worry it could come back?
Yes. In fact, I haven't. My period of quarantine was 14 days, and it already passed like 5 days ago, and I haven't been out because I just don't want to get it again.
Dr. Lee, is it possible to be reinfected?
That's a question. So there have been cases in which people have tested positive and had symptoms and went through illness and then tested negative, and they get tested positive again later. And there's a case in Japan. There's been cases in China. There was one news report that claimed somewhere between 10 and 20% of people got quote unquote reinfected. Now, it's not clear whether these were actual reinfections or whether, the test is not 100% accurate. There's the sensitivity and specificity. So could the negative test have been a false negative? We're not sure. So some of that news is concerning, that potentially someone could get reinfected. The other concern is that are there multiple strains, or could there possibly multiple strains circulating? So if you're immune to one strain, you may still be susceptible to another one. So there's a lot of information that we still need to gather about this virus. The challenge is the virus emerged in December and was identified in second week or so of January. So we still have a lot to learn about the virus.
There's a lot of stress that's connected with this. And Dr. Jeffrey Gardere is a psychologist and associate professor at the Puro College of Medicine. Welcome, Dr. Jeff.
Thank you. Thank you for having me, Mike.
Thank you for joining us. You're here to kind of help us deal with the mental health aspect of the pandemic. This is a time like no other in our lifetime. What can we do to try to cope with all of this?
Well, it is a very, very difficult time. It's surrealistic. And as we heard from Dr. Lee, there are still things that we need to discover about this virus. So just trying to get people to calm down using that kind of language of, well, you just have to stay peaceful. You just have to try to adjust. You have to be strong. You have to be brave. Really isn't working, because people are in a situation where emotionally their feet are not on the ground yet, because they truly don't know what they're dealing with. But what is important for us to understand, Mike, is that sense of panic, that sense of fear may be normal, but what it's doing is taxing our fight and flight response, where we get the adrenaline that's released, where we get other hormones and so on. And it puts us in a state of perpetual movements psychologically, where we are preparing ourselves for something, but we don't quite know what it is. Over time, that begins to break down our physical system, breaks down our psychological system, that emotional immune system is now compromised. And then guess what? Now, are we more at risk for disease and illness? Are we more at risk for COVID-19? So it is paramount that we try as much as possible to actually talk about what this feels like, to connect with mental health experts. There are a lot of resources on the internet to get accurate information, as we're getting from your particular broadcast today, but to also be able to not keep on the cable channels 24 hours a day. Get your information, move on, and try to stay with your routines and try to bring some normalcy to this new normal as much as possible. So yes, there is this pandemic that is affecting us physically, but this pandemic is also affecting us just as much psychologically. What's happening to us as far as acute stress and PTSD and depression and anxiety is truly unprecedented through this modern time.
So what would you say to Scarlet, who's trying to attempt a bounce back here, to help him bounce back?
Well, I would say to Scarlet, and I, first of all, I salute Scarlet for going through this COVID-19, staying strong, self-isolating, self-quarantining. But I would say to Scarlet, I would say to you directly, I understand where you're coming from, in that now you're, if I may use the term, you're gun shy. You are afraid of going back out because of the possibility perhaps of getting COVID-19 again, or being exposed to something else. And I think that's what a lot of us in society for a very long time, even when we go back, when the self-isolation, when the social distancing is over, people are going to continue to social distance. So I would say to you, reach out to someone. You can even speak to me if you'd like to. I'll give you my information, or it'll be passed on to you. But don't keep this kind of anxiety that you have to yourself. It's important that you use the catharsis of speaking about this, sharing with other people who've been through what you've been through, and staying in contact with others, because even though you're social isolating, it's important that you stay part of the human family. We are social animals, and it's important for us to communicate as much as possible. That will bring down some of that stress and anxiety.
I want to bring in another member of our CUNY family. Vera Rolasi grew up in Italy, but came here and graduated from Borough of Manhattan Community College. Welcome, Vera.
Thank you.
Vera, you still have family over in Italy. Let's talk a little bit about your family there and what's going on in that country. It's been very bad.
So my family's, my mom and my grandma, they're in a little town on the sea, and so far the smaller towns are fine. However, the rest of my family is in Milan, which is one of the outbreak areas. Unfortunately, they mentioned how no one is around, and at night the only vehicles that pass by are either ambulances or military trucks that carry the coffins. So it's very bad right now.
Emotionally, how is this affecting you?
Well, it's difficult to sleep at night because I think about my family and I also think about myself here. But at the end of the day, I try to relax, get my sleep, because I have to wake up and work regardless. And everyone is staying put at home, getting out the least possible and disinfecting everything and doing everything that they can.
Dr. Jeff, jump in here.
Yeah, and thank you for that, Mike, because I was thinking, first of all, another very courageous person that we have in Vera. And Vera, certainly my prayers to you and to Scarlet and to everyone else. One of the things that Vera brings up that is so important, and this is an empowerment strategy, and we need those these days. We can't control what's going on in the outside world, but we can control what's going on in our lives. It is so important, if we are at home, if we're no longer at work, have to stay at home, whether it's school, taking online classes or working from home, that we keep a certain self-discipline. Try to keep a schedule as much as possible. Before all of this happened, we had a regular wake-up time and we had a regular bedtime. It's important that we maintain those things. The things that we do during the day should follow the schedule that we had at work or at school. I have told people, and I know it sounds a little bit, tough, but, don't stay in your home wearing your pajamas or not taking care of your hygiene. Dress as if you were still going to work, as if you're still meeting people. Have regular meals. That's important. Take care, and Dr. Lee would, I think, agree with this. Take care of your physical health as much as possible so you're not at risk. Try to exercise at home as much as you can. So
okay, you touched on something that's kind of funny there. I'm trying to stay out of that kitchen here now that we're all working at home.
Well, that's the other thing. I think for a period of time, people were really overdoing it on the alcohol and the food. But I think people are stabilizing a little bit more. So it's important that we be aware that we don't self-medicate with all of those things. So really what I'm saying, just to wrap it up, is it's important to keep self-discipline in the home for yourself, because that will give you the strength to be able to move forward and recreate as much as possible a normalcy that seems to be absolutely gone at this point.
Okay, so this is hitting the community at CUNY particularly hard, and the school is actually working to try to help students out. Deborah Hart is the director of Borough of Manhattan Community College's Single Stop program. Now, they have a food pantry there, and we're going to talk about that in a second, Deborah. But I want you to first talk to us a little bit about some of the counseling help that you're offering students. Deborah Hart.
Yeah, thank you for inviting me. Our students have been reaching out to us. We've been remote for the last 3 weeks now, and having to put together several systems online very quickly work with our students. And so they have been reaching out to us for a variety of reasons. And much of what's being spoken of so far, Dr. Gardere and Dr. Lee and the other guests that are talking about the anxieties that they've been experiencing, we've been hearing from our students from BMCC. Our organization, our institution has set up, our counseling center has set up a virtual counseling. And so we link our students who want to discuss what they're experiencing in terms of the mental health aspect of this. But we all are social work counselors or social workers in the Single Stop office, licensed social workers. So to the degree that we can initially help to ease the anxiety that our students are experiencing around accessing concrete services, we've been connecting them to the various services that are available, and we've designed a sort of a one-pager to make it easy with links. And so when we communicate with our students, we're forwarding that informational sheet that has information around SNAP. It's sort of an FAQ that we ask the questions and we answer it for them based on a number of resources that we've received from various sources. So we're trying to make it as easy as we possibly can in this new environment that we're working in.
And there's some emergency funding available for students as well.
Absolutely. And so in terms of the Single Stop services, we continue to provide the core services because we still have students who are concerned about paying their rent, the utility bills. I mean, lots of institutions have relaxed many of their expectations and their rules, and so we connect the students with the information regarding that. But we have emergency funds that we provide to our students, and we have just finalized the expedited process to ensure that once a student applies for a grant, and it is a grant, that they don't have to worry about paying back. Once they apply for the grant, we get the money to them as quickly as we can. Given that everybody is remote, we're using their direct deposits, things of that nature, to be sure that we're getting the funds to them as quickly as we possibly can. And I think you mentioned the food pantry as well.
Yeah.
We are operating the food pantry 2 days a week. We've set up a system where our students can RSVP a time to come in and pick up some bags of food. I have to take a moment and really show some appreciation to my cabinet members and my president, because they've kind of stepped in a way that we were unable to, as we were under quarantine for a while at home, myself and my staff. And so they've kind of stepped in, our B&G people, our public affairs people. I mean, they've just been phenomenal in ensuring that our students are getting the pantry bags.
Okay.
Yeah.
Okay, great. Vera, do you have any questions for any of our guests?
Yes, so I've heard different opinions regarding disinfecting and sanitizing the grocery before bringing it in our houses. Do you advise doing so, or is it unnecessary?
Dr. Lee?
Yeah, so with groceries, the general advice right now is you probably want to disinfect or sanitize the packaging. So say you have a groceries within bags or within particular packages or boxes, you probably want to wipe those down because those might be immediately touched by someone. The food itself, if you eat it, then it typically goes down into your stomach fairly quickly. And there hasn't been any evidence that this virus can cause like a gastroenteritis or something of that sort. The infection route usually occurs through the respiratory tract. So that's basically the nose and the mouth, et cetera. So the main concern is the part of the food or the containers that are being touched by other people. So in general, it would be advisable to disinfect and clean those areas.
Okay, how about you, Scarlett? Do you have a question for anybody on the panel?
Yes, I just wanted to know if the virus does come back, would it come back the same way that came back the first time? And the second thing is that I was trying to do exercise the other day, and I noticed that it was different from before. Like I was getting a little more tired. Is that a virus symptom after you get the virus, or is that just the body trying to adapt again to exercise?
Well, to address your second question first, it's not surprising after being sick with the virus that you will have decreased exercise tolerance for several reasons. So one, of course, during your illness, you probably were less active, and there's probably a little bit of decompensation when it comes to your physical fitness. But also, this is a respiratory virus, so it causes inflammation throughout your respiratory system. And depending on the individual, sometimes it just affects the upper respiratory system, but it gets worse when it affects the lower respiratory tract. And so if you think about it, if your respiratory tract was inflamed throughout that period, then now you to exercise, you have to bring air into your lungs and inhale and exhale. Your body's not used to that because it's still recovering from that irritation and that potential damage. So it's not surprising that you'd be it take a little while for you to get back to feeling how you felt before. Regarding your first question, it really depends on several things. So one is, how much immunity do we actually develop after we've been infected with this virus? And the answer to that is not very clear. So the closest analogy that we have, or the closest similarity that we have, is the SARS virus from 2002. There's a study which tested the blood sera of people who had been infected with the SARS virus and recovered, and they found that they maintained a level of antibodies, a pretty even level of antibodies for on average about 2 years after the infection, and then during the third year, that level dropped. So that suggests, it doesn't confirm, but it suggests that there's some level of immunity for a couple years after that SARS virus. Now, does that apply to this virus? We're not sure. And also there's the possibility that there may, if there's another strain that circulates, then you may not have protection against that strain as well. So the immunity question is a big question because that will really determine what will happen with this pandemic. And it's something that we need more studies to figure out. I also want to add that the presence of antibodies suggests some type of immunity, but it doesn't confirm. So you can still have antibodies in your blood, but not necessarily be immune to the virus.
Okay, we're starting to run a little short on time here, so I want to get a couple of quick questions in. Dr. Gardere,
Yes.
Quick question for you. People who have children, how should they talk to their kids about this? Because they're seeing death.
I think it's very important that you find out what it is that your child wants to know. What knowledge do they have, and meet them at that place. It's not one of those conversations where you sit down with them and you break it down in a grim manner. It's information that you share with them through the day, through the days and weeks, but also letting them know that we love them and we will try to give them as normal as an environment as we can. Now it's about giving them as much stability. And finally, I would say, Mike, it's important that we conduct ourselves in a certain way, even if it means putting on that brave face, because the way that we deal with this virus, if we panic all the time, our kids will begin to panic. They'll start having that PTSD also. So it's important that we realize that we have an audience constantly with children watching us, even if they're not saying anything. And so we have to try to be very even-handed as much as possible, and having good and positive conversations with one another as adults, but certainly with our children. It is about hope.
Dr. Lee, from the CUNY standpoint, where do you see us 2 months from now, say 6 months from now, or even a year from now?
So one question is how long will we need to do social distancing? And that in part depends on several things. So one is, can we find an alternative treatment or vaccine that could then protect people? That's probably not going to happen within a year for a vaccine. People have been doing experiments in terms of existing medications to see if those can play any role in terms of reducing the infectiousness of the virus. The summer is coming up, so one question is, will the virus transmission activity go down during the summer. We see that happens with the flu. If that occurs and we do see transmission go down, we could have some kind of respite during the summer. So we're talking about 2 to 3 months from now. And that might be an opportunity to relax social distancing, but we'll have to see. And of course, the question I think was raised earlier, even if it does go down during the summer, what will happen in the fall and the winter in terms of, will the virus activity pick up again? So the one thing what I want to emphasize is that, social distancing is very important. And of course, because we don't have a vaccine, we don't have other alternatives to prevent the spread of the virus, and we're trying to flatten the curve, which basically means we want to reduce the burden on the healthcare system. So in order to do that, we have to be prepared to do this for a long period of time, because we don't want to be in a situation where we put in all this effort to do this, and then we stop early, and then the virus comes back or infects a whole lot more people. I don't want to say comes back because it's still circulating, but infects a whole lot more people, and then we would have lost all of the gains that social distancing may have provided. So one of the key things is mentally we have to be prepared to do this for the long haul. That we have to understand.
For a while.
Yes.
Okay. Thank you very much. Okay, that's a very good conversation. We've touched on a lot of subjects and lots of good information in there. I want to thank all of our guests for coming on and helping us with a very tough topic. I'm Mike Gilliam. Thank you for watching COVID-19 Crisis in Motion. And remember, stay home and stay safe.